Here at City of Hope, we do, last year in 2012, we did 618 educational sessions on campus and off campus. So that translates to about 1,039 hours of instruction.
We've worked with other educational partners.
Absolutely.
Okay. And I can tell you, if you asked me who I would want to work with from here on in, hands down the France Foundation.
The France Foundation understands how medical practices function and how the interaction between physicians and patients is important to make patients aware of the importance of our recommendations and why we're making these recommendations.
I think the France Foundation also understands how physicians learn. They don't learn at sitting reading a book or sitting reading a long, difficult thing when they're in the middle of clinic. Physicians' needs for education are more driven by, oh, I have a patient with this new diagnosis, or I have a patient with this situation. I need that information now.
Point of care learning is one of the major initiatives of continuing medical education now in 2013, and that's, I think, one of the things that we're able to do because of the availability of that kind of information to us as clinicians sitting in the clinic while we're seeing patients.
In those hats that we had to do something to educate our medical staff and our patients.
We in CME had met the folks of the France Foundation at an alliance meeting. And that's how we began this partnership to address a gap that Lucille gave voice to, and that Pfizer basically said, here's an opportunity, and that CME with France Foundation was able to create the initiative for us to move forward to correct the gap.
The ability to collaborate with the France Foundation, who actually act more as colleagues and collaborators than they do as any type of hired group. I mean, they're more colleagues with us than they are, I don't know how else, I think
Perfect.
that's the right word.
Perfect.
You know,
No, you stated it
collaborators,
perfectly.
You think of hiring a grant writer. Well, that's not how they work. They work as people that interact with us to determine the sorts of things that we need to do in educational processes. They help us identify the gaps and how to fill those gaps and help us identify interventions that will be beneficial and how to analyze our data. So, I mean, and it's all a matter of everybody talking to each other. It's not a matter of making the plans together.
You can have a great message, but if it's not tailored to how your learner learns, then nobody hears your message.
And I think that's where the France Foundation was instrumental in helping us space out the educational interventions just right, or having the tools developed at just the right moment to distribute to our learners so that they had it accessible at specific times.
They impressed me. I knew how they had worked with us and asked the right questions, or help us ask our pharmacy and our QA people the right questions for our presentation. But they also had some of their presentations, I think handful, 6 or several. With other healthcare systems. And I was impressed by their breadth, wide range, small institutions, big institutions, state institutions that they collaborated with. And I was quite impressed.
The holy grail of CME is to improve patient care. And I sometimes think that gets lost. They think that you're just having an educational intervention just to spew knowledge forth. But for people in CME, we look at it as somehow we are part of the healthcare team, and that hopefully what we do contributes to improved patient outcome. And if you improve the outcome for enough patients, you improve the overall health care of a population.
And I think with the France Foundation, they're perfectly positioned to help organizations like ourselves see the things that we can't see because we're in the middle of it.
Right.
They can really look at and analyze our systems and our collaborations internally and say, well, what about so-and-so, or what about this department? And that helps tremendously in trying to create educational pieces that are most effective.